Imagine a fog slowly descending upon a vibrant landscape. It starts subtly, obscuring details, making things a bit hazy. As the fog thickens, familiar landmarks become unrecognizable. This is what it's like to experience dementia. Dementia affects memory, thinking, and social abilities. These symptoms interfere with daily life. Imagine forgetting a recent conversation, struggling to find the right words, or getting lost in a familiar place. Dementia is not a normal part of aging. It represents a significant decline in cognitive function. Dementia can affect anyone, but it's more common in older adults. Dementia manifests differently in each individual, but some common symptoms serve as red flags. Memory loss, especially of recent events, is often the earliest sign. A person might forget appointments, repeat questions, or misplace items frequently. Difficulty with language and communication is another hallmark of dementia. Finding the right words, following conversations, or understanding written or spoken language can become challenging. This can lead to frustration, social withdrawal, and difficulty expressing oneself. Changes in mood and behavior are also common. A person with dementia might experience apathy, depression, anxiety, or agitation. They might also exhibit uncharacteristic behavior, such as being suspicious, restless, or disoriented. As dementia progresses, individuals may struggle with executive function, which involves planning, organizing, and problem-solving. This can make it challenging to manage finances, prepare meals, or make decisions. Alzheimer's disease is the most common type of dementia, accounting for about 60 to 80% of cases. It's characterized by the buildup of abnormal protein deposits in the brain, which disrupt communication between brain cells, leading to cell death and brain shrinkage. Vascular dementia is another common type, caused by damage to blood vessels in the brain, often due to stroke. This reduced blood flow deprives brain cells of oxygen and nutrients, leading to cognitive decline. Lewy body dementia is characterized by the presence of abnormal protein deposits called Lewy bodies in the brain. This type of dementia often causes fluctuations in alertness and attention, visual hallucinations, and movement problems similar to Parkinson's disease. Frontotemporal dementia affects the frontal and temporal lobes of the brain, which control personality, behavior, language, and movement. This type of dementia often manifests in younger people and can cause significant changes in personality, behavior, and language. John, a retired teacher, was once known for his sharp wit and love for crossword puzzles. As Alzheimer's disease slowly chipped away at his memory, his family witnessed the gradual transformation. Initially, it was forgetting appointments or repeating questions. He became withdrawn and easily agitated. Simple tasks like dressing himself or making a cup of tea became difficult. Despite the challenges, John's family remained dedicated, providing love, support, and a sense of purpose. They created a structured routine, incorporating activities John enjoyed, like listening to music and looking through old photo albums. Section 5. The impact on families. A shared journey. Dementia is not just an individual's disease, it affects entire families. Loved ones become caregivers, navigating a complex and emotional journey. They grapple with the heartbreak of witnessing their loved one's decline, while also shouldering the responsibilities of caregiving. The emotional toll of caring for someone with dementia can be immense. Feelings of grief, loss, anger, and guilt are common. It's essential for caregivers to prioritize their well-being, seek support from others, and practice self-care. Support groups, counseling, and respite care can provide invaluable assistance to families facing dementia. These resources offer a safe and supportive space to share experiences, learn coping strategies, and access practical advice. Remember, caring for someone with dementia is a marathon, not a sprint. Pace yourself, seek help when needed, and celebrate the small victories along the way. Section 6. The Science of Dementia. Unraveling the Mystery. Scientists are working tirelessly to unravel the mysteries of dementia. Research has made significant strides in understanding the disease processes and developing potential treatments. One focus is understanding the role of genetics in dementia. Identifying genes that increase the risk of dementia provides valuable insights. Section 7. Hope in Research Advancements and Discoveries. The fight against dementia is far from over, and there's reason for hope. Research is constantly evolving, leading to new discoveries and potential breakthroughs in diagnosis, treatment, and prevention. Early diagnosis is crucial for managing dementia effectively. Researchers are developing new imaging techniques and biomarkers that can detect dementia in its earliest stages, allowing for earlier interventions and potentially slowing down the progression of the disease. Clinical trials are underway to test the effectiveness of new drugs and therapies for dementia. These trials are exploring innovative approaches, such as immunotherapy and gene therapy, offering hope for more effective treatments in the future. Technology is also playing a vital role in dementia care. Assistive devices, such as GPS trackers and medication reminders, can help individuals with dementia maintain their independence and improve their quality of life. Section 8. Caring for someone with dementia. Tips and support. Caring for someone with dementia can be challenging, but there are ways to create a supportive and loving environment for your loved one. Communication is key, but it requires patience and understanding. Speak slowly and clearly. Use simple sentences and avoid interrupting or correcting the person. Creating a calm and predictable environment can reduce anxiety and confusion. Establish a routine, minimize distractions, and provide reassurance and orientation cues. Engage the person in activities they enjoy, adapting them as needed to accommodate their abilities. Remember that the person with dementia is still your loved one, even if their behavior has changed. Treat them with dignity and respect, and focus on preserving their quality of life. Seek support from family, friends, and community resources to help you navigate the challenges of caregiving. Section 9. The Power of Connection. Maintaining bonds. Despite the cognitive challenges, individuals with dementia can still experience joy, connection, and a sense of purpose. Maintaining social connections is crucial for their well-being. Engage in activities that stimulate the senses, such as listening to music, looking at old photographs, or spending time in nature. These activities can evoke positive emotions and memories. Physical touch, such as holding hands or giving a gentle massage, can provide comfort and reassurance. Use nonverbal communication, such as eye contact and smiles, to convey love and understanding. Remember that every interaction, no matter how small, can make a difference in the life of someone with dementia. Section 10. A call to action. Join the fight against dementia. Dementia is a global health challenge that demands our attention and action. We can all play a role in supporting those living with dementia, advancing research, and raising awareness. Consider volunteering at a local memory care facility or supporting organizations dedicated to dementia research and care. Educate yourself and others about dementia, challenging the stigma and fostering understanding. Advocate for policies that support individuals with dementia and their families, such as increased funding for research and accessible, affordable care options. Together, we can make a difference in the fight against dementia, creating a future where every mind can thrive.